Thank you, Mandy. Can you guys hear me now? How's the audio? Thumbs up in the chat if you guys can hear the audio. Is the audio good? Good evening. Good evening. Thank you for joining in. Thank you for joining in early. As you guys know, as you all are hopping in, we are grabbing our book. We are grabbing our daily harmony and liking the live. Once we hit 5K likes, we're gonna go ahead and bring our guest up. I'm trying to pin a comment. Hold on. Governor, thank you for joining in. Welcome to Office Hours with Dr. Johnson. Today's going to be a great topic. Thank you for grabbing your daily heart me. We're getting the live to 5K likes. Once we hit 5K likes, we're going to bring our guest on up. Sierra, hey, how you doing? Good evening. Thank you for joining. Okay, thumbs up in the chat. Okay, the audio is good now. Thank you. We're going to wait a little bit for our guest to also make her way over to our live. Enjoy the tunes in the background. Y'all know I'm back in Jamaica, so I switched up my background music to dancehall and reggae and soca music. Once we hit 5K likes, I'll go ahead and bring our guest on up. Thank you for the gift, Governor. Thank you for the gift, Mandy. Mandy, how are you doing today? Governor, how are you doing today? Hey, Kimmy, thank you for joining. As we're joining in, we are grabbing our daily harmony and liking the live, getting it to 5,000 likes. Once we get to 5K likes, I'm going to go ahead and bring our guest up. Hey, Adriana, thank you for joining in. We're grabbing our daily heartbeat and we are liking the live, getting it to 5K likes. Once we get to 5K likes, we're gonna bring our guest on up. Enjoy the tunes in the background. How you doing? How you doing? How is my audio? Is my audio good? Once we get to 5K likes, I'm bringing our guest on up. We're giving them a minute to come on in. Oh, Adriana, Mandy said long time no see. Oh, Lord. Perfect. Thank you, Governor. Professor Sophia, thank you for joining on in. I didn't know if you're going to be able to make it because I know you're telling you were doing your story time, but thank you for joining in. We are grabbing our daily heartbeat and we are liking the live, getting it to 5K likes. Thank you for sharing the live. Once we hit 5K likes, I'm going to go ahead and bring our guest on up. Thank you for sharing the live, Professor Sophia. Thank you. Yes, today's going to be a good conversation. I'm excited. This week, I have 3 conversations, 3 office hours that I'm looking forward to. Today is the first one of the week. I have 2 more for the rest of the week. I'm looking forward to these conversations. They're going to be meaningful conversations, and they're excited to drop gems. I'm doing good, Adriana. I am working and on vacation, as you can see. Thank you for sharing the live. Thank you for doing the redo, undo, Sophia. Thank you so much. Governor, thank you for liking the live. Once we get to 5K likes, I'm going to go ahead and bring our guest on up. Thank you for the gifts. As you are joining in, we are grabbing our daily heartbeat and we are getting it to 5K likes, and I'll bring my guest on up. Thank you for the heartbeat. Once we get to 5K likes, I'll bring my guest on up. Thank you for the gift. I am loved. As you all know, I am back in Jamaica, so the background music has changed. Pure dancehall, pure soca, pure reggae. Thank you for sharing the live. Thank you for sharing the live. Once we get to 5K likes, I'm going to go ahead and bring my guest on up. Like I was telling them, this week I have 3 office hour sessions. Today is the first office hours for the week. I'm looking forward to this one. I have a lot of questions to ask. And I know that person has great information to share. So I'm looking forward to today's conversation, Thursday's conversation, and I think my other one is on Friday. I have to check. But I have 3 office hours for this week. All great information, all great professionals, all doing great work within their community. So I am excited for this week's office hour sessions. Yes, Governor. You know what? I was on Governor. We have to talk soon, okay? Because I was just on your page and checking out some things, and I think you got some good things. So I'm gonna explain what office hours is. Virtual office hours, like for example, like when you were in school and you meet with your professor, you go into their office hours. So the office hours over here is me meeting with my community and just in either teaching a subject, teaching a specific topic, or interviewing a guest. And I've been interviewing guests in healthcare, other professors, engineering, in STEM. Hey, Divine Alchemy, thank you for joining in. Today I have a great office hour session that I'm looking forward to. So yes, Governor, it's a variety of things, either teaching a topic or doing an interview. And today I'll be interviewing a professional doing great work in the community. So I'll send you a message so we can further the conversation because I have a couple questions for you. Her Divine Alchemy, how are you doing, ma'am? Thank you for joining in. Everyone, as you are joining in, we are grabbing our daily heartbeat and we are liking. Damn, why aren't telling me we have 5K likes? Hold on. I wasn't ready to start yet. I was liking the song. Hold on. Y'all, we have 5K likes. Let me make it brighter. How before I bring the guest up, I'm great. I'm doing great. I'm doing great, ma'am. Thank you for asking. Decline. Why is somebody requesting to call? No, I got things to decline. Okay. How is the audio is good? Thumbs up in the chat if the audio is good before I bring the guest on up. Everyone, thank you for joining in. As you guys are joining in, we are grabbing our daily heart me and we are tapping the live. Perfect. Audio is good. Okay. The guest she better be. Okay, yeah, there she is. Miss Mika, Miss Mika, Miss Mika.
Hello.
Can you see me? Can you hear me? Is the audio good? I was having issues the other day with this microphone, but can you see me? Can you hear me?
Yes, we're doing good.
Okay, perfect. Are you gonna stay with camera off or you gonna stay with camera on? What you gonna do? What you wanna
Nope,
do?
I'm bringing my camera on. I'm just going to put on a green screen since I have all these pictures of my child in the background.
No
So,
problem, no problem. Takia, thank you for joining in. We are grabbing our daily harmony and liking the live. We got the live to at least 5K likes, and I brought up our guest for today. As Miss Mika is getting herself situated, like I was saying, I am excited for this week's office hour sessions. I'm excited for this week's office hour sessions because these 3 individuals are doing great work in the community, and you guys know I do my homework and I go out and search for those who are, their work and their overall purpose and mission aligns with what I want to do with my office hours. So this
yes.
3 office hour sessions for this week, I'm excited for them. They all have great things to share. As you guys see, the first office hours interview guest this week is Miss Mika. She is a familiar face. Before we get started, thank you for taking the time out to step into office hours with Dr. Johnson. I know you're about to go on vacation soon, so thank you for
Yeah.
spending this time to step over my community and just bless us with your gems overall, Miss Mika. Okay, and
Thank
thank you.
you for having me, Dr.
No,
Johnson.
no problem. And thank you for keeping it under wraps. You guys all know I like to keep it a surprise. I like to keep everybody on their toes. Who is he going to bring up next? Who is he going to bring up next? And
Yes.
Miss Mika was like, no problem. I got you. So everyone, thank you for joining. We are going to go ahead and get started. Before you hopped on, Miss Mika, somebody asked me what office hours was. So I just want to give a brief background of what the office hour session is. Before I do that, praying hands and a thumbs up is me acknowledging you guys in the chat. I don't want to interrupt our guests as they're speaking. Praying hands or a thumbs up is just me saying acknowledging you. I see you in the chat saying a thank you, but I don't want to interrupt the guests. Office hours with Dr. Johnson. As I am building a community around healthcare administration, I wanted a way to give back to my community and share my acquired skills, my acquired professional experience to those who are interested in my content and interested in learning more about healthcare administration or just wanting to go back to school overall. I wanted to kick it up a notch and add in a professional development aspect of it where I bring on other great healthcare professionals, professors. Last week I had an entertainment attorney come on. So people who are doing great work in the community who have great things to share. So that's where the office hours comes into play. Miss Mika, once again, these office hours are not about me. These are about the guests who I am bringing on up. So I want to hand it over to you. I want you to just start us off with your overall background as it relates to your education, professional. Who is Miss Mika? Don't dive too much into it because you know I did my homework. You know
Absolutely.
I got my questions for you. So you know, briefly tell us education background, professional background. Who is Miss Mika?
Of course, very brief synopsis of me. My name is Mika, as Dr. Johnson has so graciously invited me on his office hours. Thank you very much. As for my educational background, I have a bachelor's in communications from the Florida State University. I graduated in 2007. I have an MBA from Syracuse. And then now I have gotten my master's in marriage and family therapy from Capella. And I have been a therapist officially for a year and 2 months now.
Nice. I love that. Thank you for sharing that brief synopsis. You know, I have a series of questions for you. We're going to be diving into various different topics. Once again, I wasn't going to let Mental Health Awareness Month pass without me inviting you over into office hours. So that's what the basis of today's conversation is going to be about. Okay. But so
Absolutely.
first I want to start off. What piqued your interest in working within the mental health space? You know, you said you started off as an MBA and then you got over into therapy.
Mhm.
What piqued your interest?
So, what piqued my interest is that I'm one of those people in my family and my friend circle. I am the strong friend. So, everybody comes to me for advice and all of that. And I've always enjoyed being that person to be a shoulder to lean on, an ear to listen. And honestly, to pat myself on the back, I really do feel like I give really good advice, honestly.
Right.
So that has always been my motivation to, I can do something more to help my community and the world overall. So that's what really got me started. When I was a child, I wanted to be a school guidance counselor. So this kind of ties in with that.
Right. Right. Nice. I like that. The questions I'm going to be asking you, I know the answers to some of them, but those here out in the community, they may not know. Okay. So, as it relates to being a healthcare professional, what does it mean to protect your license?
So protecting my license means, because as people know who have seen my page on this app, I come on and I talk about mental health, mental wellness, and psychology facts. So for me, protecting my license is making sure that I am saying things like a therapist, but not your therapist.
Right.
This is not legally advice for you. This is just my opinion.
Right.
Protecting my license means not putting my name on things that I wouldn't be professionally proud to put my name on.
Right.
Protecting that license that I studied for, cried over, and paid for is something I'm always going to do, and I'm never going to attach my name to BS. So protecting my license means always having integrity.
Nice. I love that. Thank you for your perspective on that. Continue staying on the topic of protection. What is HIPAA? Why is it so important? What does it protect from your
HIPAA?
perspective? Yes, HIPAA. What is that? What that is? Let the people know what is HIPAA.
So HIPAA protects not only our patients, it protects us. As a clinician, as a provider, HIPAA protects me from giving out your information. A great example, if you guys have been on TikTok over the last, weekend, few days, there was a young lady, a nurse, an LPN, working in a long-term care facility on live.
Okay.
And she was doing a med pass on live. Now, I'm not going to say that this is the case for where everybody works. Where I work, there is a social media policy.
Right.
If I am in my office, I cannot be doing stuff like getting on live. I can't be making personal phone calls and being on speakerphone, because what if somebody hears something?
Right.
HIPAA is there to protect us and our patients, because I don't want to get sued. Dr. Johnson doesn't want to get sued.
Right.
So HIPAA, please always remember HIPAA. No provider, nobody that works in the medical field, nobody that works in healthcare should be talking about your information outside of the walls of that clinic, that hospital, your room that you're in. Always make sure that you are keeping that information protected, and that way you keep your job in healthcare, friends.
That way you keep your job in healthcare. Yes. And you know what? When I saw that video, there was another video where the lady was, I don't know if it's the same one, but she gave out the wrong medication. Where
Yes, it's the same exact young lady. And then she ripped open a lidocaine patch with her teeth.
right. You see, when I was working in the hospital, it was a level one trauma center. It was the OR, the surgical services department. None of us had time to sit on the phone.
No, because your phone should be put away. Right. There's too much going on, too many patients. There's way too much.
Right. Okay. Let's move on. Over here in Office Hours with Dr. Johnson, we like to touch on touchy subjects, but we're going to address them, in a healthy manner. And that's what it's all about with Office Hours and with having conversations with professionals, okay? I want to change gears. Let's talk about your overall experience in undergrad. I have quite a few supporters on here who are not really in the healthcare background, but they're interested in going back to school. They're interested in figuring out, hey, should I do this now? Let's talk about your overall college experience as you got to where you are.
Okay. So I started out college. I actually had gotten enough credits to be a sophomore when I got to college because I had a dual enrollment program in high school. So I didn't take a typical route. I kind of, did my extras and got credits and stuff before I went to Florida State. Being at Florida State, I had a really good experience, but it's kind of difficult when you are a Black person at a PWI because you have to find your community, but then it can be difficult to find your community because you're too much of this and too little of that. But overall, my experience at Florida State was wonderful, and I wouldn't trade it for anything. Were there difficult times? Yes. Were there times where I wanted to cry, give up, and drive home? Absolutely. But once I found my community and I really got into my communications program, that helped me a lot. There were some disappointments when I was in my program because I applied for internships, as we all do in undergrad. And the one internship I wanted so badly, I got turned down. And it broke my heart. But you know what you do? You pivot. So I pivoted and I applied for another place. I got it, and it was the most amazing experience. Right. And then when I went to grad school, when I went to Syracuse, it was it was an experience. I'm not going to say it was bad. It wasn't great, but it wasn't bad. I was only there for 2 years to get my MBA, so I enjoyed myself, but I immediately hightailed it right back down south because I don't like being cold, so I came back home.
You brought it back to the Florida water? You came back to the Florida water?
Sure did. Okay. Sure did. Came right back to Florida, as one would. Okay. And I spent a few years actually working as a retail store manager, and then I started working for a CPA business, working in there. I just worked in the office doing little stuff, and then I decided, I was like, you know what? I don't want to do this anymore.
Yeah, and healthcare is where it's at.
Healthcare is where it's at, but then there was a whole other life before that. Before I even got into healthcare, I went and worked in, how do I say it? I was in the military at one point, and then I got out of the military, and I went and worked for a 3-letter agency in the Army side, so CID. But I worked on the civilian side of it, and it was a really interesting experience. But that experience itself is what triggered me to know I need to go work in mental health, because the things I saw and the things I dealt with, I knew others dealt with, and I needed to be a light in the world to go help those people. So it really kicked my butt into going into healthcare and working in mental health.
Wow, thank you for sharing that. For those of you just joining in, Office Hours with Dr. Johnson. Today I'm speaking to Miss Mika. May is Mental Health Awareness Month, and this is a subject matter expert as it relates to mental health. We mentioned pivoting. I want to stay on that topic, okay? And I want to stay on the topic of current college students. I recently did some videos, some content on changing your major and not being afraid and still being able to succeed, okay?
Yes.
So you did communication, you did MBA, you did marriage, family, and therapy, right? Is that it?
Yes.
You changed your major and you're still successful. Can you just touch on that? Changing your major and not being afraid to explore while you're in college, because, hey, you can still be successful.
Absolutely. You should never be afraid to pivot and learn new things. I stuck with my mass comm program because I did enjoy it, but I felt like I was too deep in to pivot. And so I took that time right before I applied to grad school to really dig in and be like, what do I want to do? Because my MBA is in project management.
Okay.
And so digging in, I was like, you know what? This is a great niche for me. Like, I'm so good at this stuff. I'm really successful when it comes to this. But never be afraid to pivot. Life is about learning. Life is about being a lifelong learner, and life is about change. Right. You're never too old to learn something new. You're never too old to, if you didn't graduate high school, go get that diploma. You're never too old to go to college. You're never too old to get a grad degree. Okay. Your brain thirsts for hunger and for getting that learning experience. Like, you have to just be confident in yourself. I don't care to tell my age. I'm about to be 40. Okay. So me pivoting at this stage of life to go get my license and be a therapist, people thought I was crazy. My friends looked at me like, girl, haven't you been in school long enough? No, I haven't, because God says it's not my time to be done with school yet. He needs me to go ahead and find the path that I'm supposed to be on. And since I've taken this path and I pivoted, I've been wildly successful. And I would never change it. This is where I'm supposed to be. This is my home, is mental health. So I'm glad that I took that leap when I was scared, and I did it, because I wouldn't be where I am now if I hadn't have done it. So any of you out there listening, please don't doubt yourself. Please pivot and make those changes, because you can do it. Yes.
Exactly. Never too old. And they said that, yes, that part I had to get out of that age mindset a few years ago. Yes. You just touched on ageism. You can't let ageism affect you.
Exactly.
We're gonna keep the conversation going, because y'all know I do my homework. I got 2 pages of questions for Miss Mika. Okay.
I'm excited.
Mika, with you, staying on the topic of pivoting. Okay. With your experience and acquired knowledge thus far, what other area would you pivot into, career-wise?
Career-wise, what would I pivot into? If I had to make a pivot, if healthcare was poof gone tomorrow, I would pivot into education. I think I would pivot into being either a professor or I would pivot into school administration, especially for the younger ages, K through 12.
Okay. I can see that. I can definitely see that. We're going to switch gears. Remember, we switching gears. Okay.
Absolutely. We level up.
Right. I want to get on the topic of mental health. Okay. Everyone, May is Mental Health Awareness Month. I brought on a subject matter expert as it relates to mental health. So I want to ask her a series of questions. Whatever she shares, she's not saying that that's the only thing or the only route for you to do. That's just a best practice. That's just a recommendation. I like to have these healthy conversations on here, because you never know. With these conversations, we don't know who we're influencing. We don't know who we're motivating. We don't know who needs to hear this. You know how many times I've gotten a message that said, Dr. Johnson, you posted that specific video talking about this topic, and I prayed a couple of days before, and this was my sign. So thank you. Absolutely. Every time I get a message, that just gives me the push to keep going and keep having these conversations. Okay?
Yes.
So May is Mental Health Awareness Month. I want to keep pushing that. May is Mental Health Awareness Month.
Yes.
Mika, let's talk about some best practices on staying on top of your mental health overall.
Staying on top of your mental health, very, very important. So it doesn't have to be this massive thing of, oh, I need to find a therapist, I need to do this, I need to do that. Staying on top of your mental health is something as small as getting yourself a treat, taking a moment away and just sitting with yourself, praying, meditating, breath exercises. It's the little things. It's the taking a walk outside in nature. We call it ecotherapy. So go outside in nature and walk amongst the trees, breathe in the clean air. This is not the end all be all of things, but yes, please go out there and do the little things. The little things are what's going to help you. Something I really like to push is something I call a happy meal. So if you ever see me in my story saying, find your happy meal, what's your happy meal today?
My last question at the end. Explain to us what a happy meal is. I told you I got you. I told you don't got to overshare too much, because I got it all laid out.
I'm going to hold it. I'm going to let you have it at the end.
Hold that one. I told you I got you.
Yes, I'm going to hold that one. But yes, mental health and taking care of it, do the small things. Read a book. Read your Bible. Meditate. Just the small things. For me, as a therapist who works with people all day long, as a therapist who has her own Because as a therapist,
Mhm.
you should have a therapist too.
That was my next question too. Let's jump into that. As a
So
mental health professional, do you have a therapist? Shouldn't you already know all the tips and tricks yourself to not have to have a therapist? I just threw in that question right there as a regular person who is not in healthcare or not in mental health.
yes,
That's what they assume. You're a therapist yourself. Why would you need a therapy? Let's touch on that.
yes, I absolutely have a therapist, and any clinician worth their salt should have their own therapist
Right.
because we are taking on the problems, the energies of so many people throughout our days, weeks, months, years.
Right.
We also have our own problems in the background. Can we solve our own problems? Absolutely.
Right.
But it's better to have somebody to bounce it off of because the way I practice
Mhm.
in marriage and family therapy is not the way that another therapist is going to practice. We all have learned very similar things, but we all have that niche. We all have our specialty. There are general therapists, there are trauma therapists. So absolutely I have a therapist and I ain't ashamed to say it. I've had a therapist before I was a therapist. It's important.
Nice.
You got to clean your brain.
Okay. Say that. Say that. What you just said? You got to what?
You got to clean your brain.
Right.
You got to
Okay.
clean it up.
You got to clean it up. Right. Okay. We're not going to switch gears, but we're going to stay on the topic of mental health. But there has been a lot of discourse on here about black men not going to college. Okay, I did a video on that. Just shed light on that. But I want to talk about the importance of black men going to therapy. Okay, and let's kick the topic up a notch. They
Yes.
are saying black men not going to college. Are black men? Let me not say it like that because that's going to pivot into my next question. The importance for black men to go to therapy, Ms. Mika, what's your professional take on that?
Black men 100,000% need to be in therapy. I
Okay.
don't say that as a slight. I
Okay.
say that because black men deal with a lot of trauma that they don't address. Black men are often seen as nothing but bodies.
Mm.
They're not seen as personalities. They're not seen as people. They're seen as black bodies walking around this earth that are sometimes good for something like playing a sport, but oftentimes they're seen as good for nothing other than being baby daddies. That's traumatic.
Very.
Black men are seen every day getting pew-pewed, put in jail, deported, any other myriad of things. Black men do not need to be ashamed to need to talk about their feelings. You have to feel your feelings. Black men, hear me. Black men in this room, black men outside the room, hear me when I tell you, find a therapist. And it's not necessarily going to be the first therapist that you go see.
Okay.
Sometimes you need to try 5, 6, 7, 8, 15 different therapists until you get to that one that clicks for you. But I need you to take care of your mental health like you go to the gym and like you go to the ball fields and like you go to the golf course. Take care of this up here because it's all connected.
Right. Right. Speaking of trauma and anxiety, okay, that's my next question. What would you say are some good best practices? And use my correct verbiage, my professional verbiage. Best practices in overcoming trauma and or anxiety.
So your best practices for overcoming trauma and anxiety.
Mm-hmm.
For anxiety, I like to tell my clients, especially because right now I work with a lot of little people, so a lot of students, babies.
Mm-hmm.
A lot of it is breath work. A lot of it is calming work. So things like pressure therapy, hugs, things like that help with anxiety. As far as trauma, I like to sit with people, and for some adults, I'm not necessarily like certified in this, but I've experienced it and been in the room when it's happened. Things like CBT, so cognitive behavioral therapy, ketamine therapy, for you to kind of work through all of those issues. Journaling. I will always push journaling. Please, please, please write down your thoughts, feelings, questions, all of that. Even if you don't bring it to your therapist, just so you have it. But anxiety is a really, really large one that I'm dealing with right now because I work with adolescents and a lot of them are anxiety ridden, which is so sad to me. But yes, pressure therapy, breath work, talking it out, finding a safe person to talk to. Like I tell my babies, please find a safe adult, be it Miss Mika or your teacher or whomever. Please find a safe adult and talk to them. Safe, 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 safe spaces. That's what you need. Safe spaces.
Safe spaces. I love that. In the chat, exactly. Men need mental health too, and there is nothing wrong or weak about that.
Absolutely, Miss Sophia. I agree.
Continuing on your patients, right?
Mhm.
Obviously, we have to follow HIPAA. You have to follow HIPAA. You have to protect your license. Y'all see how I just brought those two terms you just taught you and piggyback it over here to this next question I'm going
Absolutely.
to ask? Okay. Your current patient pool, what demographic do you see? I'm asking that because we just spoke about Black men not seeking therapy, but you just said that a lot of your patients are adolescents. So, could you share with us what's your most frequent demographic? Men, women, children, adults? What is your demographic?
So my most frequent demographic
Mm-hmm.
this year, because I switched to a different facility, is now adolescents between the ages of 6 and 13.
Okay.
I do have a couple of older children, but most of mine are between 6 and 13.
Okay.
Prior to this, when I was working in a private office,
Mm-hmm.
funnily enough, most of my patients were men.
Okay.
Black men, actually.
Okay. That's what I asked that question because I wanted to know. But I'm glad to hear that. That's good.
Yes.
Um, Next question, staying on this topic. Stigma you would like to address. I'll repeat it again. Any stigma you would like to address as it relates to mental health. With your acquired professional skills in the mental health space, what is one or two stigmas that you want to address? Let us know, Ms. Mika.
A stigma that I want to address, which we've already kind of touched on it.
Yes.
Seeking therapy does not make you weak. It
Okay.
does not. Seeking out therapy actually makes you very strong because you understand that you have some things to work on that you
Right.
can't do by yourself.
Right.
Also, this one is a controversial one, but people who have ideations and they do not want to be here any longer,
Mm-hmm. You
there's
pause.
not.
You're such a professional. I like how you worded that. I don't know if everybody else in the chat got that, but you such a professional, and I love to have these conversations with professionals who know their stuff. I just gotta
Yeah,
highlight. So thank you for your verbiage. Continue.
absolutely.
Sorry to cut you off, Miss
Just
Professional.
because somebody has ideations
Mhm.
doesn't mean they need to be like rescued. Sometimes people just have thoughts. It's kind of like when people, it's not funny, it's not a joke, but some people are like, I should just take this car and turn it this way.
Okay.
Invasive thoughts.
Right.
Not everybody who has ideations needs to be saved. When they need to be saved is when things start really coming to fruition, when you start noticing things.
Okay.
But ideations are not necessarily a horrible thing.
Mhm.
People just, our brains are all, they're supposed to be wired the same, but everybody's brain is wired differently.
Sure it is.
So don't judge people because they've said, oh, hey, well, one day I had a thought of ending it all.
Mhm.
Some people have those thoughts. It's my job as a therapist to say, okay, well, what brought you to this space?
Right. Let's unpack
Why are
that.
we here today?
Yeah. Right. I
But yes,
love
those are my two.
Okay, I love that. Staying on the topic, and I've had this conversation personally and professionally. As it relates to therapy, people are open to it, but they're not open to medication. From
Mhm.
your professional standpoint, when would you suggest somebody to, hey, you need therapy, but maybe you could also accompany it with medication versus not needing medication, is needing the therapy? What's your perspective on that?
So I don't think that there's anything wrong with being medicated as long as the medication is done correctly.
Right.
You don't want to go to a psychiatrist who's going to just write you on a pad and it's a pill mill and they're
Right.
just giving you what you want.
Right.
But people who are really struggling, like people who have bipolar, some people who have focus issues like ADHD, I think those are appropriate times to medicate.
Right.
Now, I will say therapy can help you with a lot. I can help you through a lot, but there is some things that I can't help you with. I can't 100% help you focus.
Right.
I can't always help you out of a manic episode, but you know what can help you? Medication. So please go see a psychiatrist who can actually prescribe you the medication. I know several. There are several in my clinic. I will make sure that I go talk to them and we go over your records, all three of us in a room, and we will see what's best for you. And then I will step out as your therapist and you continue with the psychiatrist. And once you get medicated and they feel like, hey, maybe I can bounce them back to you. Okay, yes. But yes, medicine is appropriate in certain places. Absolutely. And I will never say otherwise.
I love that. Thank you for sharing that. For those of
Absolutely.
you just joining in, we have Miss Mika. We are discussing everything mental health. May is Mental Health Awareness Month. So far, we've gone over her education and professional background. She has shared what piqued her interest overall as it relates to mental health. She gave us a breakdown of HIPAA. I know what HIPAA is. She know what HIPAA is. Some of you may have heard about it, but she gave us a breakdown of what it is, what it protects, and why it's important. She also gave a breakdown on best practices on staying on top of your mental health and overcoming trauma and anxiety. Let's keep the conversation going. I have three sentences that I have written down here. One of them is explain to us what is a happy meal. Explain to us what is a happy meal.
Okay, this is my favorite thing ever to explain.
Mm-hmm.
So, when I was in grad school getting this degree to become a therapist, one of my professors, it was like, she said something like, "What made you happy today?"
Mm-hmm.
And I was like, you know what? I'm going to end up working with a lot of kids. Let's turn this into something kids know, a happy meal. But then I also use it on adults. If you guys do follow me or if you plan on following me, a lot of the times in my stories, I'll put something like, Happy Tuesday.
Right.
Don't forget to grab your happy meal today.
Right.
A happy meal is three things. One, two, three things. It has to be three, guys. Entree, side, drink. Three things that made you happy today.
Repeat
It can be the smallest things in the world. It can be the biggest things in the world. So, example, let's use my daughter as an example. I ask her this stuff when she gets out of school. Hey, baby, what was your happy meal today? I got to play outside at PE. I worked on my art project, and my teacher told me I was being a good example. Mm-hmm. Happy meal. Three easy things that made you feel good today. So I encourage everybody in this room, if you take anything from this conversation, please take away a happy meal and remember to keep happiness above all. Remain positive.
Perfect. Thank you for sharing that. Next sentence. Okay with not being okay. Okay with not being okay. What is your professional perspective? You hear okay with not being okay. You guys, this is those of you just tuned in. May is Mental Health Awareness Month. I am speaking to a subject matter expert as it relates to mental health. I'm sorry to repeat myself, but you know how this goes. As they're jumping in, I want them to know what today's topic on office hours is, okay? So, Miss Mika, okay with not being okay, what comes to mind when you hear that?
It's okay to not be okay.
Mm-hmm.
Not being okay doesn't mean you're broken.
Right.
It doesn't mean a bad life. It just means a bad moment. It doesn't mean a bad chapter. It just means you're having a bad day. Right. And it's okay to not be okay. But even though you're not okay right now, you will be okay.
Okay. Okay. Switching gears, because we will consistently switch gears over here. Okay, Ms. Mika, you ready?
I'm ready.
Like I said, we touch on, controversial topics, but we address them in a healthy manner, in a professional manner. The current political climate, how has it affected your work overall? You and I, we had that conversation the other day, but I told you hold on it because we will bring it on over here, okay?
Yep.
The current political climate, how has it affected your overall work?
So it has affected my overall work. It hasn't been too big of a shift, but I know the shifts are coming. Mm-hmm. Especially because, like I said, my biggest group of people right now is adolescents. Okay. And the effects of things going on in the school system, the cuts to SNAP benefits, all of these things. Our health secretary today talking about, I'm not recommending COVID shots anymore. Mm-hmm. These things affect what I've got going on at work. I work in an inpatient clinic. Mm-hmm. I need the people who come into this clinic to be healthy. So you're telling me that you're not going to recommend these COVID shots. That affects my job because what if I get sick? Then I can't see my people who need me. Right. Then you're talking about, it sounds weird, but people being on SNAP benefits ties in directly to what I do. I live in the state of Georgia. A lot of people in this state are living in poverty or they are very poor. So, Peach State Healthcare, Medicaid, Medicare are things that are being used by people in my clinic to take care of themselves, their children. So these people are also on SNAP benefits. So then I'm dealing with my clients coming in, they're hungry. So now I'm really overfilling my fridge that's in here, my snack bags that are in here. I have to take care of my clients so they can take care of themselves. And I'm coming out of my pocket to do it because of this administration. I'm not saying that the prior administration or anyone prior to that administration was perfect.
Right.
But we are currently living in a puzzle that we can't escape. This is Jumanji.
We're taking steps back. We're taking multiple steps back. Yeah.
And this is going to affect everybody. You guys are seeing the small stuff right now. In healthcare. We're really about to start getting hammered. My sister is an ICU nurse. They are low on supplies because of this administration. That's scary. When my sister works at a level 1 trauma hospital, they need those supplies. And they're having to pull from all of these different hospitals in their system. This is going to affect us big time, y'all. So please, please pay attention to the news. It's scary and it's trauma inducing watching and paying attention, but you need to be informed. So thank you, Dr. Johnson, for that amazing question, because that one is very important to me. And I know it's important to you too.
Amen. And just you shared an example. I want to share an example. You shared an example as it relates to healthcare. I want to share an example as it relates to higher education. I recently got an email about our president being requested to send in. I think I shared this with you already a couple weeks ago when we had the conversation.
Yeah.
Our president of the college is requesting our research information and all of our topics that we want to teach. It's being requested by the Department of Education. You know, obviously, the Department of Education is doing what they're doing right now, right?
Yep.
You all know that as it relates to cultural competency for healthcare professionals, I can't teach that. You all know as it relates to specific topics in ethics in healthcare, it kind of deals with diverse patient populations. When you hit the word diverse, I can't teach that.
Yep, that's gone.
I want to show you guys. She just provided an example as it relates to healthcare. I want to provide an example as it relates to higher education. Let's keep the conversation going, right? What would you say to someone who's feeling discouraged about working within healthcare, given the political climate right now, you know?
Okay.
Them not wanting to be a part of all the chaos. I'm going to be honest. Let's call it chaos, okay?
Yeah, honest.
What would you say to that person right now? I will tell them, hey, healthcare is where it's at. The money is here. There are so many different avenues you can go into. It does have its ups and downs. That's just me. I want to hear from you.
Yeah, absolutely. So for me, healthcare is a great place to be. And we need all of the good people that we have right now.
Right,
if everybody now takes this moment to run, hide, and bail, we're going to lose it all.
Right.
It's already hard enough keeping people in healthcare in certain aspects. And like Dr. Johnson said, there's so many different options to working in healthcare. People don't seem to see all the options outside of like doctor, nurse, CNA, things like that. But there's so many options. Most people don't even look at therapists as healthcare people. They just see us as therapists. We're in our own little box over here. But no, bring me to the big box over here, because I'm in healthcare too.
Right.
But be discouraged. Don't be like, you can be upset. Don't be discouraged.
Right.
Because we only have to deal with this right now. And if we all bond together as a force, he can't fire us all.
Right.
They can't make us all quit.
Right.
So we just have to continue to band together. Just like I'm a part of the National Alliance on Mental Health. Okay. And so I'm not on the board. I'm a paying member. I go to conferences, things like that. Okay. So people need to be aware. Join organizations. Get organized with your peers that are working in this same field. We are stronger together.
Exactly. Thank you for sharing that. I have 2 more questions, and I'm going to get to the last question that I asked all of my guests, okay?
All right.
Kind of staying on the same topic we're on. Advice for someone wanting to gain experience within the field who's newly licensed. What recommendation, what would you share with them to do?
So my advice for somebody who's new in the field, so what I did, I'm going to give you what I did. I went to a lot of community health events, and living in Georgia, I went to a lot of rural community events.
Networking.
Yes, you have to. Everything right now is about networking. Go talk to people.
Mm-hmm.
Put out your feelers. While you're still in your program, put out your feelers. Go talk to people in the area you live, the area you want to practice in. Get those hours started. I when I originally started, I talked to, which is funny, my daughter's guidance counselor, and was like, "Hey, I really want to pivot into mental health care because she is also a therapist." And she was like, "Do XYZ." And so I started doing a lot of volunteer work. So I went and volunteered at shelters right alongside social workers and other therapists. And I gained that experience that made me be able to network and have stronger connections when I actually went into here to be interviewed, to sit for my exam, all these things. It just made life so much easier. So I encourage you, network. Networking is key. If you're shy, stop being shy.
Yeah.
Because a closed mouth is not going to get you fed. You have to get out here and network. Do the things. Do the hard things. That's what I tell people. Do the hard things. Those hard things are going to pay off. So go get them done. Network, network, network.
Right. As it relates to healthcare and as it relates to higher education, you got to network. And imposter syndrome, you just like to shy and just not want to do that. Imposter syndrome, I just want to briefly touch on that. Imposter syndrome is the devil. That's all. It's all in your head. Okay, you belong where you belong. Okay,
Absolutely.
I don't want to claim that on me. But when I first stepped into higher education, I was the youngest within my college, the College of Business and Computer Science. Don't ask why they had health management in the College of Business and Computer Science, but it was. I was the youngest one. Everybody there, I could be their grandson. I was 31 years old. My students was twice my age. There were multiple times where I was like, did I make the right decision coming all the way up? And you already know what city I was driving an hour to go to school.
Absolutely.
Okay, so I was kind of feeling like, do I belong? Da, 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 da. Imposter syndrome was kicking in. I said, I have a doctorate degree. I have years of experience. My department chair put me aside and was like, there's a reason why we brought you on because of your clinical administrative fellowship that you did, because of the thesis that you did. You're going to be helping our students complete their capstone. So going back to what I just said, there's a reason why you're in the rooms that you are in. Don't let imposter syndrome cloud your judgment.
Speak on it, Dr. Johnson. Absolutely. Because imposter syndrome is nothing but an agent of chaos, and chaos is an agent of the devil. So let's not do that.
Let's not do that. Right. I got a last sentence for you. Gratitude and celebrating our victories. It may sound familiar to you because I went down all of my guests. I go on your page. I study your content. I formulate my questions like that. And I saw that Miss Mika was talking about gratitude and celebrating our victories and celebrating our small wins. You did a video on that. I want you to come bring that over here and just drop that gem for us.
Gratitude is the word of the day.
Mm-hmm.
Always be grateful for all things, big, small, and in between. Have grace for others, but also have that same grace for yourself. Make sure you go celebrate those small wins. Hey, I got out of bed today. That's amazing, bestie. Hey, I made my bed for the first time in 2 weeks. I'm super proud of you. I fed myself today for 3 separate meals. I didn't sit here and just say, I'll get something later. I actually got up and fed myself. I'm grateful that you got up and did that, and I'm so proud of you. Celebrate that small win. Gratitude is the attitude, and we celebrate all victories around here, bestie.
Thank you for sharing that. So that brings us to our last question. I'm sure you already know it, and I'm sure you prepared for it, okay?
I didn't even prepare, so hey.
Okay, Miss Mika.
Yes.
What is your overall why? Your overall why as it relates to the work that you do in mental health. Your overall why as it relates to you being a mother. Your overall why as it relates to being a Black woman working in healthcare. Your overall why in today's society. Can you share with us what is Miss Mika's overall why?
My why is me having a little set of eyes looking at me every single day. She is my why. She is my encouragement. She is my little broke best friend. She will tell me about myself when I don't feel like hearing it. She will encourage me. She is my biggest why. But my other whys are, I see people out here every day wanting to be better, wanting to feel better, wanting to figure out how to do the hard things. They are my why. My community as an overall is my why. I want to see those who look like me win. I want to see everybody win, but I particularly want to see people who look like me, people who look like Dr. Johnson. I want to see us win because there's so much on our backs, so much on our shoulders, and so much against us. I want to be even the smallest glimmer of, you look at me and say, well, she can do it. Why can't I? Or she did it. I can go ask her questions because absolutely, come talk to me. Send me a DM. We will chop it up. I will tell you everything that I can legally to protect my license. But other than that, I bet you I can find you a resource. If I don't know and my resource don't know, we can find you somebody else who knows it. Those are my whys. My why is I want to make an impact on this world. When I leave this world, I want people to say, wow, Mika did that. She really did this. She did X, Y, and Z while she was here. She was celebrated while she was here. We're going to give her her flowers when she's here and when she's gone. My why is simply that. It is making an impact on this world in the best way that I know how. And I've been making an impact since long before I got this degree, long before I was a clinician, and I will continue to make an impact until the day that the breath leaves my body and the Lord calls me home.
And thank you so much for sharing your story, your overall story. Thank you so much for sharing Miss Mika's story, okay? Let me drop you off. You know, we gotta save our points. I'm still learning, y'all still building. But let me drop you off. Do not disconnect. Once again, thank you so much for taking the time to step over into office hours with Dr. Johnson. I'm sure you know that after this is done, they're going to be downloaded, posted on YouTube. You're comfortable with me downloading this conversation?
Absolutely.
Perfect.
Go right ahead.
Thank you so much. Enjoy your vacation. Enjoy your.
Thank you so much. And thank you for having me. I really appreciate you considering me to bring me on for Mental Health Awareness Month. For a parting word, please.
I wasn't gonna let May pass by. I wasn't gonna let May pass by and not bring on another subject matter expert in mental health. So thank you so much for taking the time.
Thank you so much. I really appreciate you. You continue to be safe over there at home. Enjoy yourself, and we will talk soon, my brother.
Perfect. Thank you. Enjoy your vacation, okay?
Thank you.
Okay. You all, that's what it's all about on Office Hours with Dr. Johnson. I want to continue having meaningful conversations. I want to continue sharing resources for those who want to go back to school. I want to provide examples and resources for those interested in healthcare administration, and obviously trending topics or current events. I want to make sure I'm tying that in and relaying it in May, Mental Health Awareness Month. I'm bringing on all the professionals. So once again, thank you for joining in. I'm checking out. Okay. Bye, y'all. Good night.